I'm Jennifer Ward. My next guest on the Ward Wellness Report is Shirley Kakowski. She is a dental hygienist, and she'll talk to us about the benefits of cranberry for oral health, which is so interesting, Shirley, because I don't think a lot of people would understand how this is possible.
They don't, and I think a lot of people in my field don't understand it either, so I'm very excited to be able to talk about it with you today.
Tell us about this new revelation.
Well, I guess it all comes down to the manipulation of an oral biofilm. So that would be what we used to call plaque on teeth. It's that mushy kind of a cream of wheat kind of stuff that kind of hangs on your teeth right there.
That paints a lovely picture, doesn't it?
Yeah. And so what we've always done in the past is we would berate our patients to brush and floss, brush and floss, brush and floss. Well, it occurred to me maybe 5 years into my career that people can't brush and floss their teeth the way that a dental hygienist can. And they're always going to be falling short. And we're always only having these two answers for them. And there had to be other answers. So I started to look for other answers, and I found a few. And cranberry is one of those really super answers that we have available to us today.
And again, it addresses the biofilm.
Exactly. So the biofilm is a little bit different than what we used to call plaque, in that it has a series of bacteria that join into this grouping at different stages. And the earliest colonizers are the ones that are affected mostly by cranberry. So if we kind of domesticate that bacteria and make it more difficult to stick onto the teeth, it has a harder time, those bacteria have a harder time inviting others in. And when all those others are not available to come into the biofilm, they kind of just drift off and get swallowed.
Now, I understand, too, that the cranberry and cranberry powder, when used with brushing, has great benefit for gum health.
Right. It all kind of comes back down to this biofilm. If there's no biofilm there, then the gums are healthier. We know that periodontal disease, for instance, is affecting about 80% of the population of all ages. So it's a big, big problem. And what we used to say in dentistry is that, oh my gosh, you're going to lose your teeth, you're going to lose your teeth. When really that's like the secondary outcome of this periodontal infection, because we have an inflammatory response that goes throughout the entire body when we have this biofilm on our teeth that's affecting the structures around the teeth.
It also cuts down on bleeding gums, which I find amazing.
Well, that's exactly what periodontal disease is. That's what most people will find as kind of a mid-stage of their own gum disease, that they'll see some pink in the sink. But when you come to see a dental hygienist, we see it a lot earlier, and then we mention it to our patients, and they just think we're just poking them.
Which you are.
And causing them to bleed. But really, it's a response to any kind of manipulation, and primarily to that bacteria, which the cranberry helps to dissipate.
So Shirley, let me ask you, how often do you have to brush with cranberry?
Well, the best amount of time is to do it twice for about a minute each, with the 36 milligrams that are required for efficacy. So by using that amount on your toothbrush and then brushing for a full minute at least, and then we're against rinsing anymore, so go ahead and just spit out the excess and just swallow the rest, and do that twice a day, and you'll see some really important changes in your gums and in your teeth. Your teeth will get a little whiter. The packs and the way that the cranberry is made for oral use will help remove some of the stain. The staining may occur if you're using these other types of cranberry, the sprayed juices that are dried like that. Those will stain your teeth. So the way that they're made today, the oral cran for toothbrushing will remove any stain that's been accumulating over time.
And once again, it does actually help with fresh breath, doesn't it?
Yeah, that's another really cool aspect to this whole thing. When you have this bacteria in your mouth, they make an odor, the bacteria themselves, and as they're destroying your tissue, it also creates an odor. So you have this double whammy of this bad breath kind of thing happening. So by using cranberry, you're going to reduce all of that, including on your tongue. It's really important to also clean your tongue. When I graduated in 1986, and it wasn't that big of a deal back then. We were all worried about the teeth, but today's dental hygienists are taught how to clean somebody's teeth as part of the dental hygiene appointment. So the cranberry would be very helpful with that as well. In long-term care, we talked a little bit about what happens in a care facility. Just using the cranberry on the tongue with a little sponge on a stick will also help reduce that biofilm on the tongue. Tongue coating in long-term care is an indicator, a risk indicator for pneumonia. So, there you go. It's a problem.
Absolutely. So once again, when you are brushing your teeth with cranberry, you simply just put the powder maybe in the palm of your hand or keep it in the cap, put the toothpaste on your toothbrush, a dampened toothbrush, dip it in the powder, and away you go.
And away you go.
Yeah, a couple of minutes, you think?
At least a minute. We like to always say about 2 minutes, but if you can at least get a minute in, most people brush for just a few seconds, so you really have to just tough it out.
And it doesn't have a flavor, does it?
No, not very much, no.
Yeah. All right. Shirley Gakowski, thank you so much for joining us today. It's been great. Your teeth look amazing.
So do yours.
Thank you. Thanks for joining us on the Ward Wellness Report. We'll be right back.